Diagnosed with tennis elbow, got some shoulder pain, tricep pain, neck pain, or even some numbness and tingling down into the wrist and the hand, this video is for you. Well, what's up everybody? Dr. Maggio here. I am the creator of the Peak Method and the founder of the Soft Tissue Revolution, and we're on a hell of a mission to make chronic injuries obsolete by helping people that are injured and in pain get properly educated and informed on their injuries so they can get access to quality, hands-on soft tissue treatment and avoid bigger problems down the road like pain pills, injections, and surgeries, which only make things worse. So we're back at it for my favorite segment, Ask the Doc. Got a really good question this week from Jessica on Instagram. I have been dealing with what they diagnosed as tennis elbow for going on a year now. I have done 3 cortisone shots, had an MRI come back that was deemed normal, did a month of PT, and I wear a brace every day, but it seems to be getting worse each day that passes. Now I'm even getting some tingling in my thumb. I'm only 28 years old, and I really am afraid of that I'm going to need surgery, and who knows if that will even work. Is this problem fixable? What advice would you give me? Thanks. Thanks so much, Jessica, for sending in that question, and sorry to hear that you're dealing with this, but this usually is what happens in what I call the medical merry-go-round, where they're just like, hey, your elbow hurts, that must be the problem, let's inject it with a bunch of cortisone and see what happens. But the thing about cortisone, and I talked about that all the time, and if you're consuming this video on YouTube, I'll put a link down about how I really feel about cortisone shots. Spoiler alert, cortisone shots are garbage, and so is the doctor who gave it to you. So that'll answer that one, but it's worth a watch as well. But what I always try to get to, and what we're always looking for, especially people that are trained in my method called the Peak Method, where we're really getting to the root cause of what's going on. So whenever you hear things like tennis elbow or bursitis or tightness, it doesn't really give us a tissue-specific problem about what's going on. So what I end up seeing a lot in these unresolved tennis elbow. So let's just talk about what tennis elbow is. Basically, it means you get some pain in the lateral part of the elbow here. It doesn't really tell us anything. It doesn't tell us what's causing that pain or how you got it in the first place. So there's a couple areas that can cause problems in there. The first one can be overuse. So when the muscles are overworked, we spend a lot of time on a computer typing, using our hands and stuff like that. All these muscles really deep inside the forearm, they get overworked and they're just going all day long. Imagine if you walked around and you flexed your bicep. Those muscles would get beat up and overworked as well. That's what's happening in through here. So what happens is now these muscles start to develop some scar tissue. Scar tissue is like glue that gets inside the muscle, makes that muscle weaker, makes it less flexible. Over time, that scar tissue gets bigger and bigger. Now these muscles can't generate force. So one of the problems that can end up happening is it can put more force on the tendon itself. And then the tendon actually starts to develop like what's called some degeneration. Most people think it's called tendonitis. It's not. It's actually called tendinosis. Basically, what happens is when this area is getting overloaded and overworked, the body starts to lay down more tendon to help buffer that area. But what happens over time is it's not good quality, so that tendon actually gets worse. Here's the kicker. Cortisone shots actually make tendinoses worse. So I'm big on this idea of like a conspiracy theory that the orthopedic surgeon's trying to make you worse so he can justify surgery. Another thing that can start to happen is as that scar tissue builds up, it expands. And when it expands, it actually causes these nerves to get stuck to the muscle. When these nerves get stuck, they can cause numbness, aching, burning, and tension. I know Jessica was saying she was getting some pain down into the thumb and into the wrist. So there's a really big nerve, and I covered this earlier in the week in what I call my muscle of the week, but there's a really big nerve called your radial nerve, and it starts in your neck and works its whole way down through the arm. And a lot of times what happens is with poor posture, accidents, trauma, sitting, not looking down on the phone all day long, puts a lot of pressure on these muscles in here. And the same thing happens. They develop that scar tissue and it spreads out. Nerves are built with like 15% of like extra slack to keep them healthy. And then usually what happens is they get stuck here and then they come underneath the armpit and they pull. So a lot of people present to me with lateral elbow pain, and then as it gets worse, they start to feel it in their tricep, they start to feel it in their shoulder, they'll feel it in their neck, and when it gets really bad, they're feeling it down here through the hand. So basically what happens is that nerve is getting stuck and it's getting yanked down there. So where the place of least resistance is further down, so you're gonna feel it in the elbow, you're gonna feel it down there as well. So a lot of times that's what's happening. And the details are what matters. And a lot of times when you go to practitioners, be it a chiropractor, physical therapist, orthopedic surgeon, massage therapist, they want to jump right into treatment instead of actually figuring out what's going on. That is the difference about the people that are trained in my method called the peak method. Their first job is to figure out exactly what your problem is. Then they can know if they can fix it, what they can do to fix it. And that's what's happening. So sorry to hear you're dealing with that, Jessica. No more cortisone shots. Please don't get those anymore. They just make things worse. The issue that you're running into is that it's a multifactorial problem, and it's not just one thing. So the brace, it's helping stabilize that, but it's coming from everywhere else. So if this video helped you, you know somebody that's dealing with tennis elbow, dealing with getting too many cortisone shots, neck pain that won't go away, the best thing you can do is share this video with them. If you like it, give it a comment, a share. If you don't like it, then whatever. But if you ever have any questions that you specifically want me to cover, just send in a message. We're always here to help. We love doing these videos. They've really helped a lot of people. And lastly, if you're tired of being in pain, you've tried a bunch of other stuff, you're still in pain, you're running out of hope, all the information to get in contact with a peak method trained provider will completely change the outcome of your injury, change your life, get you on the path to getting better. Appreciate you guys watching the video. Thanks again, Jessica, for sending in the question, and I'll see you on the next one. Bye.